Have you noticed that lately, your feet feel just a little bit heavier, or that the edge of the rug you used to step over without a second thought now seems to catch the toe of your shoe? Perhaps you have caught yourself stumbling on an uneven sidewalk, your heart leaping into your throat as you quickly reach out for a wall, a piece of furniture, or the arm of a loved one to steady yourself. If this sounds familiar, I want you to take a deep, comforting breath, because you are not alone, and more importantly, it is not your fault. Welcome to the Senior Health Podcast, a safe space where we discuss the real, often unspoken challenges of aging, not to cause worry, but to give you the exact tools you need to protect your independence and keep moving with absolute confidence. Today, we are diving deep into a topic that many people over the age of 60, and especially after the milestone of 70, face every single day: the sudden, frustrating increase in trips and stumbles. It is a quiet anxiety that sneaks up on us, making us look down at our feet while we walk instead of looking ahead at the beautiful world around us. But today, a prominent surgeon reveals the true, hidden biological reason behind why this happens, and it has nothing to do with just getting old or being clumsy. Even better, we are going to look at a simple, 3-minute fix that you can do right from the comfort of your favorite armchair, a gentle movement that no one else is talking about, but one that could quite literally save your life. When we cross the threshold of 70, our desire to remain independent, to tend to our gardens, to walk to the grocery store, and to play with our grandchildren remains as strong as ever. However, the fear of a sudden fall can begin to shrink our world, making us stay home more often or rely on others for things we used to do with ease. To understand how to stop a trip before it ever happens, we first have to understand the simplified science of what is actually changing inside our bodies. Many people assume that stumbling happens because our muscles are simply getting weaker, but a closer look from a medical perspective reveals a much more specific culprit hidden in our lower legs. It all comes down to a vital medical concept known as foot drop, which in everyday terms simply means the gradual weakening of the tiny muscles on the front of your shin, primarily one called the tibialis anterior. Every time you take a step, this specific muscle is responsible for lifting your toes upward toward your shin so that your foot clears the ground cleanly. As we reach our 70s, if we do not intentionally activate this muscle, it naturally begins to go to sleep. When it weakens, even by just a few millimeters, your foot doesn't lift as high as your brain thinks it does. As a result, your toes begin to drag slightly during the middle phase of your stride. You might not even notice it on a smooth hardwood floor, but the moment you encounter a slightly raised doorway, a thick carpet, or a small crack in the pavement, that dragging toe catches, and suddenly you are fighting to maintain your balance. But the mystery of why we trip more often after 70 goes even deeper than just a single muscle in the shin. It involves a beautiful, complex system inside our bodies called proprioception, which is essentially your brain's internal global positioning system, or GPS inside your joints, tendons, and muscles, particularly in your ankles and feet. There are millions of microscopic sensors that constantly send lightning-fast signals to your brain, telling it exactly where your feet are positioned in space without you having to look down at them. When you were younger, this internal GPS was incredibly sharp. You could walk across a rocky beach or a dark room, and your ankles would automatically adjust to the uneven ground in milliseconds. However, as the decades pass, the communication line between these sensors in your feet and your brain can become fuzzy and slow. It is like trying to make a phone call with a very poor cellular signal. Because the brain receives the message a split second too late, it cannot tell your leg muscles to adjust quickly enough when you step on an uneven surface. By the time your brain realizes your balance is off, the stumble has already begun. This delay is precisely why so many seniors report feeling perfectly fine one moment, and then suddenly finding themselves on the ground the next, wondering what on earth they just tripped over. There is another hidden factor that many standard fitness guides completely overlook, and that is the profound impact of everyday medications on our physical stability. It is very common after 70 to be prescribed medications to manage blood pressure, heart health, or mild anxiety. While these pills are incredibly important for your longevity, they can secretly ruin your balance in a way that feels very discouraging. Many blood pressure medications, for example, work by relaxing your blood vessels. When you sit in a chair or lie in bed for an hour, your blood naturally pools in your lower legs due to gravity. The moment you stand up to walk, your relaxed blood vessels cannot constrict quickly enough to push that blood back up to your brain. This causes a sudden, temporary drop in blood pressure known as orthostatic hypertension. It might not always make you feel dizzy enough to faint, but it often causes a subtle, momentary cloudiness in your vision or a brief feeling of unsteadiness right as you take your first few steps. If your brain is slightly deprived of oxygen for just 3 seconds, and your internal GPS is already running a bit slow, your risk of catching your foot on a stray object skyrockets. This is why so many trips occur not when people are out walking miles down the street, but rather right in their own living rooms, moments after rising from a comfortable chair or getting up in the middle of the night to use the restroom. Now that we have uncovered the real, scientific reasons behind these stumbles, the sleeping shin muscles, the fuzzy brain to foot communication, and the hidden effects of medication, it is time to shift our focus away from fear and move directly into empowerment. The solution to this problem does not require you to join a crowded gym, lift heavy weights, or engage in grueling, sweaty fitness routines that leave your joints aching. Remember, the core philosophy of our community is that protecting your independence should always be simple, safe, and gentle. You do not need extreme physical fitness to stay safe. You simply need to restore the natural, intelligent communication between your brain and your feet. To do exactly that, we are going to learn a highly effective, 3-minute daily ritual that a leading surgeon recommends to all of his senior patients. This routine is specifically designed to wake up your sleeping shin muscles and instantly sharpen your body's internal GPS. The best part is that you can perform this entire routine while sitting safely and comfortably in a sturdy chair, eliminating any risk of falling while you practice. Let us break down this 3-minute ritual together, step by step, so you can begin practicing it today. To start, find a comfortable, straight-back chair where your feet can rest flat on the floor. Take a moment to sit up nice and tall, allowing your shoulders to relax away from your ears. This upright posture immediately opens up your chest and allows oxygen to flow freely to your brain, setting the stage for a calm, focused practice. The first minute of our ritual is dedicated entirely to waking up that vital shin muscle we spoke about earlier, the tibialis anterior, through a movement called mindful toe taps. Keeping your heels firmly planted on the floor, I want you to lift the front of both feet up toward the sky as high as you comfortably can. Imagine you are trying to point your toes right up at the ceiling. Hold that lifted position for a brief, 1-second count, feeling a gentle tightening along the front of your shins, and then slowly lower your toes back down to the ground. We are going to repeat this gentle lifting and lowering at a slow, rhythmic pace for 1 full minute. As you do this, do not rush. Think of it as a pleasant, steady rhythm. Lift, hold, and lower. Within about 30 seconds, you will begin to feel a warm, tingling sensation in your shins. That warmth is a beautiful sign. It means fresh, oxygen-rich blood is flooding into those long dormant muscles, gently reminding them how to lift your feet high enough to clear any obstacle when you walk. Once your first minute is complete, we move immediately into the second part of our ritual, which is designed to sharpen your brain's internal GPS and improve ankle flexibility. This movement is called the seated alphabet. For this minute, you will lift your right foot just an inch or two off the floor, keeping your knee bent and relaxed. Now, using your big toe as if it were a piece of chalk, I want you to trace the capital letters of the alphabet in the air in front of you, starting with a large, clear letter A, then moving smoothly into a letter B, a letter C, and so on. As your foot moves up, down, left, and right to form these shapes, the microscopic sensors inside your ankle joint are forced to constantly fire signals back up to your brain, updating it on the foot's exact position every single second. This dynamic movement acts like a powerful amplifier, clearing the static out of that fuzzy cellular connection between your lower body and your mind. After about 30 seconds of tracing letters with your right foot, lower it gently to the ground, lift your left foot, and continue the alphabet from wherever you left off. By the time you reach the letter Z, you have successfully recalibrated your internal balance sensors, training your brain to react instantly whenever your foot encounters an unexpected bump on the ground. The final minute of our 3-minute ritual addresses the hidden trap of fluid pooling and sudden blood pressure drops, ensuring that your body is fully stable the very moment you stand up. We call this final piece the calf pump ritual. While still sitting safely in your chair, plant the balls of your feet firmly on the ground, and this time, lift both of your heels as high as possible, coming right up onto your tiptoes. Squeeze your calf muscles tightly at the very top for 1 second, and then slowly lower your heels back to the floor. Repeat this rhythmic heel lifting for the final 60 seconds of your practice. Your calf muscles are often referred to by cardiologists as the second heart of the human body. Because they are wrapped tightly around deep veins, every time you squeeze your calves, they act as a natural, built-in mechanical pump, squeezing the blood that is pooled in your lower legs and driving it smoothly back up toward your torso and brain. Doing this simple movement right before you stand up ensures that your brain remains perfectly alert, completely eliminating that brief, dangerous window of unsteadiness or dizziness that so often leads to a sudden trip.